To now do the skill of placing someone on a bedpan, and as always our skill starts with a knock on the door. Hi, I'll be right with you. I just need to go wash my hands. I'm going to come directly to the sink and wash my hands exactly the same way as I did in the hand washing video. Now that my hands are clean, I'm ready to go to work. Hi, how are you doing today? My name is Ms. Andrews. I'm going to be your PCT for today. Is it okay if I take a look at your name badge? Thank you so much, Mr. Smith. I hear you need to use the bedpan. Are you ready to do that now? Yes. Okay, I'm going to raise this rail up for your safety because when I return from getting my supplies, I am going to raise the bed to a comfortable working position for myself. You have your call-away. I'm going to give you some privacy. Let me go just get the things I need and I'll be right back. As always for this skill, we are going to cover the bedside table. I always like to take a couple of extra barriers with me just in case, you never know, it's good to have them. I'm going to need a bath blanket, a pair of gloves, 2 washcloths for washing and drying the patient or resident's hands, 2 clean chucks, dirty linen container. The rest of the supplies we need are in the patient's lower drawer of his bedside dresser. In addition to these items, I always like to take a trash can with me too. I'm going to use a chalk to put on the chair. Cover the chair. I'm going to take out patient's toilet paper and their bedpan. Okay, Mr. Smith, I think we have everything and we're ready to go. I'm going to be raising your bed now. Doing okay? I'm just going to move this call light out of the way. I am at the bedside. Mr. Smith, I'm just going to ask that you assist me when I change your blanket for you. I'm just going to get your clean linen out of the way. I'm going to keep you nice and warm and covered up with this bath blanket. So can you please just hold this top blanket for me so I can remove the other? Thank you. Okay, Mr. Smith, you're a little bit too far to that edge of the bed, so I'm going to have you move toward me just a little bit because I am going to be rolling you over. So just assist me to move your shoulders first, and then your hips. Perfect. And now just your legs. That's great. Okay, on the count of 3, I'm going to ask that you please reach for that roll. We're going to roll you over. Just bend your knee. 1, 2, and 3. Let me move the pillow for you. Okay. I'm going to place the bedpan down. I'm going to press down on the bed a little bit. And on the count of 3, Mrs. Smith, I'm going to have you roll toward me and onto the bedpan. 1, 2, and 3. If you want, go ahead and bend your knees. It might make it a little more comfortable for you. Let me just fix your head. Okay, you okay where you are? Okay. You're not too close, right? Can you lift your hips for me 1 second? And over. Good. Okay, Mr. Smith. I'm going to raise your head just a little bit. Get your call light back to here. Here's your toilet paper. Are you comfortable there? Okay. Your call light is within reach. It's right next to you. I'm going to put the bed down. And as soon as you're ready, just call me and I'll be back to take you off. Okay? Okay. I am going to go outside here now and allow Mr. Smith to have some privacy while he goes to the bathroom. If I didn't hear back from him within a few minutes, I would come back and just call to him and check and make sure he was still okay. He has now indicated to me that he's ready to be taken off the bedpan, so I'm going to go back in. I do like to announce myself on the opposite side of the curtain, just so he knows that I'm there and I'm coming in. I'm coming back in, Mr. Smith. You ready?
Yes.
Okay. Gonna raise the bed back up again. I'm going to put on my gloves. You never want to touch any of the patient's belongings, their call light, or anything that belongs to the patient with gloves on. That's why it's good to have those barriers, just in case if you have your gloves on and you wind up having to make an adjustment or touch the call light or something, you have those things there so that you can use that as a barrier. Okay, Mr. Smith, I'm just going to take your toilet paper from you. I'm going to have to, we have to put your head down, so I'm going to use a barrier. Go ahead and put your head down. I'm going to put your head back down. Okay, I'm just going to ask that you assist me. Again, you can put your legs down. I'm going to ask that you assist me to roll over. I'm going to hold this bedpan down for you on the count of 3. 1, 2, and 3. Great. Okay. So now what I'm going to do is I'm going to remove this. Can I have you lift up just a little bit? Thank you. I'm going to remove this whole thing. I'm going to place it here. Cover it. I'm going to place a new chuck. Just going to put a nice clean chuck underneath you, okay, Mr. Smith? Okay. And now I'm going to have you roll, oh, watch your hand, I'm going to have you roll right back toward me again. Very good. That's perfect. I'm going to give you a washcloth and a dry cloth so you can wash your hands. And you can place them right there when you're done. Okay, I'm going to remove one glove and I'm going to throw that in the garbage can. I'm going to keep my gloved hand on the dirty and I'm going to keep my ungloved hand on the clean. And I'm going to continue to give him as much warmth and privacy as possible. Oops, sorry, I think you're first caught. I'm going to remove this dirty linen. Okay, Mr. Smith, here's your call light. If you need anything, I'll be back in a minute. I just need to get rid of all this stuff, okay? Can you put your bed back down? Okay, I'll be back in a moment. Take this with me. I'm going to take this with me. And can I please have the floor? Okay, so now what I'm going to be doing is, I have a barrier here because I did take off one glove. Just gonna look, I'm gonna take a look, and I'm going to see, I'm gonna check to make sure there's no blood, that it's not unusual looking, that it's not over the top, odoriferous, and make sure that it in general looks okay. If I saw anything that looked very unusual, that's something I'd like to report to the nurse. But this one looks fine, so I'm gonna go ahead and get rid of it. I'm gonna open the bedside commode. I'm gonna dump. I'm gonna get rid of these. I have my barrier, and I'm gonna rinse. 1, 2, 3. Dry. I'm going to shut off my water. I'm going to get rid of this and make sure this bedside table is clean. I'm going to bring this back with me. Oops, sorry, Mr. Smith. Okay, Mr. Smith, back for one more second. Close the door. Remove my gloves. I'm going to wash my hands. Okay, Mr. Smith, I'm back. You doing okay? Okay, I'm just going to fix you up on the side a little bit. Going to fix this for you. I'm going to remove the wheel. Privacy. Okay, Mr. Smith, would you like your lights on or off? Would you like your TV on or off?
On.
Would you like your window open or closed?
Open.
Okay, again, my name is Ms.Andrews. I'm your PCT. If you need anything, just use your call light. Have a good day.
Okay.
I'm now going to end the skill by washing my hands again before I leave the room.